All right.
Okay, well, welcome everyone. Thanks for being here today. My name is Dr. Kristen Myers, and I'm a psychiatric nurse practitioner. I own Joyful Mind Psychiatry in Ames, and I started my business a couple years ago, actually, and I started doing behavioral health coaching first, and then last year I converted that over to psychiatry, and I'm now offering psychiatry and therapy services out of my office up in Somerset. So, something that I'm very passionate about is working with individuals with autism and ADHD, or the word that they refer to that now as being neurodivergent. So something that has really interested me and that I like to speak out about is about masking. And so today is going to be not just about autism, ADHD, but mental health in general and the masks that we wear and how we are trying to find our identity when we live in this world of expectations. So today we're just going to explore why we wear masks, how masks affect our mental health, and how we can begin to take them off and live more authentically. So, oh, I should have went to this slide next, but here's my office. This is what it looks like up in Somerset. There's my address, and encourage you to go to my website, joyfulmindpsych.com. You can actually self-schedule your appointment on there if you would like to do an initial intake evaluation, but we do diagnostic evaluations here, medication management, individual therapy, and then ADHD diagnosis and treatment. All right, so we're going to set the scene to start here. So some current statistics to kind of get you thinking about where things are at in the US with mental health. 1 in 5 US adults experienced mental illness last year. This data comes from 2022, 2023. So at that time, about 59 million people in the US had a mental illness, which if you think about, like, that's a huge amount of people, 59 million, 23%. So mental health issues are incredibly common, and they're a lot more common than we realize, and a lot of them are ones that we don't necessarily see. But even though millions are affected, there's a stigma that keeps a lot of people silent. 1 in 20 adults, or 5%, actually live with serious mental illness. Serious mental illness is defined as things like schizophrenia, bipolar 1 disorder, um, major depressive disorder that is treatment resistant with psychotic features, that sort of thing. What's really concerning is that only about half of people with mental illness receive treatment. So if you look at that 59 million people, only half of them are going to get treatment. And the reasons for that are usually either they don't know what's available to them, or there isn't anything available in their area, or they're afraid to seek treatment. Mental illness is most common now among young adults age 18 to 25. There's a lot of research that they continue to do to explain, why that is. One of the big things that kind of explains it is that there's a lot of things that come from our childhood and our upbringing and our experiences as a child and as a teen, and we tend to those things tend to not become known, or don't maybe necessarily stand out or become problematic until the person reaches young adulthood, when they're first having to go to college, go out on their own, live on their own, and have those stressors. And so those things tend to trigger the mental illness, and then it starts to come out, and that's why we see it occurring in that age group most commonly. And then over 50% of people with mental illness fear that others will judge them negatively. So again, these pressures that we have lead us to end up wearing masks, where we might pretend that we're okay, even though we're struggling on the inside. And this ties directly into why we feel pressured to perform roles or to wear masks in life. And it's because this stigma is just such a powerful force that pushes people into hiding. I'm going to show a short video. It's about a minute long. I'm not going to lead into it with anything because I just want you to watch it and just kind of see, we're going to see what your reaction is to it at the end of it.
Morning. Hey, Ricky. Ah, I like the way you do it. Oh, what's up, man? Morning. Morning. Good night.
Hey, I just want to let you know that Ricky took his life last night.
Okay, so some of your initial reactions to that. I remember when I first watched this video, it was actually one that when I was teaching psych mental health nursing at Grambee University, I had a group of students that did a presentation and they included this video on there. And so that's probably about 10 years ago, and I have since used this video numerous times because to me, it's so impactful. When you were watching that, you probably were very focused on the main gentleman, this guy, and you saw him, living day-to-day life. Maybe he has kind of like a flat affect, maybe doesn't seem to be enjoying life. He's taking medication, he's having trouble sleeping, he probably seems very isolated, lonely. He's going to work every day, and you kind of start to get that it's kind of chaotic, and you kind of think that maybe he's overwhelmed, out of control. And then at the end, you find there's the part where it introduces that Ricky ended up committing suicide. And if we were to watch this again, you probably would notice Ricky. But Ricky was the man that was saying good morning every day to him on the elevator, and that you could see kind of standing in the background, and he was smiling throughout this. And what I think this video really does a good job of showing is how, depression, mental illness is not always obvious. There's, kind of like a stereotype or a certain look that we think that people who are depressed would have. I think that, a lot of people will imagine somebody who is crying all the time, not getting out of bed, just outwardly obvious that they're depressed. But most people who are going through major depression, and who are having suicidal thoughts, a lot of them look and appear very normal. Um, what they're doing is masking, and they're on the inside suffering, struggling. On the outside, they're, as you saw, smiling, going to work every day. And then when suicide happens, it tends to be very sudden, startling, and then we're left with a lot of questions as to why. Um, and so that's what in the world. Well, I didn't know I added that little transition. That was kind of cute. But now I want to go into kind of some things about suicide, because the numbers are becoming very concerning in our country. So in 2022, 49,449 people died by suicide in the US. It's important to know that this is actually the highest number ever recorded in US history, was in 2022. And it's now the 11th leading cause of death overall in the US. In 2022, there was 12 million adults that seriously thought about suicide, 3.5 million that made a plan for suicide, which would be things like thinking about, okay, I'm going to overdose on these medications, or I'm going to go obtain rope or things to end their life. And then in 2022, 1.7 million people actually attempted suicide. And 60% of people who die by suicide had an underlying mental health condition, and it was often undiagnosed, untreated, and oftentimes there was something with stigma associated with why they weren't getting adequate treatment for it. So still on the topic of suicide, something that I am very passionate about speaking out about and just raising awareness is kind of a warning. This is very startling to me and to people in our profession, but for ages 10 to 14 and 25 to 34, suicide is now the second leading cause of death for them, behind accidental injuries and like motor vehicle accidents. So it's just so concerning to know that we have 10-year-olds, 9, 10, 11-year-olds who are committing suicide or who are thinking about suicide. It's a very, very young age, and really kind of clues us into how, we do spend a lot of time treating adults and educating adults about suicide and trying to prevent suicide in the adults. But where we're really lacking, and have been for a long time, is the kids. We forget that these thoughts, these experiences that are leading to depression, anxiety, isolation, bullying, that sort of thing, that those things are happening much younger, and that if we wait until they're an adult to try to intervene, it's going to be too late. It's especially concerning among LGBTQ youth, children experiencing bullying, youth that have trauma histories, and youth with autism and ADHD. Specifically with bullying, that includes both in-person and online. That's something that's been, in the research and has been in the news a lot. When you hear about suicides that have happened, we've had several even in just our community here in Ames and Gilbert. There was evidence of some bullying in some of those cases. Oops, I don't want to go that far yet. But other things that can contribute to this problem in this age group are family stress, so things like divorce, economic hardship, being exposed to suicide, so having a parent or a family member or a peer, even in the same grade or in their school, commit suicide, emerging mental health disorders that start coming out in adolescence and young adulthood, so depression, anxiety, early onset bipolar disorder, that can create more risk for them to commit suicide. And then just kind of touching on the neurodevelopmental, neurodivergent conditions like autism and ADHD, those conditions also increase their vulnerability if it's not properly treated. So ADHD is strongly associated with increased suicide risk. They found that it's 2 to 5 times higher risk of suicide attempts amongst these individuals. And some of this is due to ADHD's impulsivity. Being impulsive can increase the risk of actually acting on suicidal thoughts. So when someone's impulsive, they kind of lose that or ability to pause first before acting. And so they can go from having the thought right to actually doing the act. A critical factor for autistic individuals in this case is the masking and the camouflaging. They found that the masking and the camouflaging that autistic individuals have to do to try to fit in to society or to fit into the classroom or to the work setting is strongly correlated with suicidal thoughts and behaviors. because constantly pretending to be normal ends up being linked to exhaustion and hopelessness and feeling like you don't belong. So something to kind of think about with the kids in particular, we start teaching children to mask from the time that they're born. Masking isn't all bad. So I don't want you to think that today's presentation is about how all types of masking are bad. I'm going to get into a little bit more detail about the different types of masking in a moment, but just kind of something to reflect on is how, this is kind of how the human race evolves and how we operate, as a species, is we start teaching our children to mask, and we do that, for various reasons, which I don't want to get ahead of myself. I'll wait to the next slide. But something to think about is, are we teaching them healthy masking or is it destructive masking? So here are some of the types of masks. So when I'm talking about masks that people might wear, are you any of these? There's the overachiever. And that's somebody who might be always busy achieving and pushing limits. They might hide their feelings of inadequacy or their fear of failure. They might be having thoughts like, I have to prove my worth through constant success. There's the class clown. That's someone who might be using humor to deflect more serious conversations. They might hide anxiety, sadness, and fear of rejection behind, making people laugh or just so that people can't really see how they're actually feeling. There's the caregiver, and the caregiver is always helping others, putting their needs first, avoids focusing on their personal struggles because they're so busy focusing on other people's struggles. So they think to themselves, if I'm busy taking care of everyone else, no one will notice that I'm struggling. There's the stoic mask. So that's someone who might appear just unbothered, calm, in control. They might hide their vulnerability and their sadness behind the thought that showing emotions feels unsafe or makes them appear weak. There's the people pleaser. This is someone who might agree with everyone to avoid a conflict. They might say yes, even if they're exhausted and don't have the capacity to do something. They often lose sight of their own personal needs. And so they tend to go with the thought that it's just easier to just keep the peace. Then there's the perfectionist mask. And this person likes to project flawlessness at work, flawlessness in their appearance or social life, but they really actually fear criticism and judgment if any of their imperfections show. So there's someone who might be thinking, I can't let anyone see me fail. The social butterfly, they might be always upbeat, social, always kind of turned in the on mode, but they hide their loneliness behind being social. And they might be thinking, I can't let anyone know that I feel alone. And so I'm going to be in a crowd so that they don't notice. And then lastly, another example is the I'm fine mask. So this is someone who might respond with I'm fine, even when they're not. So they avoid vulnerability or burdening others by thinking that their feelings don't matter or that people won't care. These are just some examples of masks. These are not all inclusive, but these are just kind of ones that, a lot of people can identify with. None of these are bad or wrong. None of these are, inappropriate, or if somebody, if you are a caregiver or you do tend to have times when you're a perfectionist, that doesn't mean that there's destructive masking going on, that there's a lot more to it, but this is just at least a starting place for you to think about what some of these profiles of people who are masking might look like. So let's talk about why we wear masks in the first place. So first, it has to do with survival. And so we are wired to belong, and that goes with safety and preservation of our species. But the masks often start as self-protection. Second, we live under a lot of social expectations, and that can come from our family, our culture, the workplace setting, but there's always a script that's kind of telling us who we should be because we want to fit in. And if we don't fit in, then we're not safe. And if we're doing too much of that, then it can become destructive to our mental health. Third, many people hide mental health struggles because of stigma or fear of being misunderstood. So some of us feel like we have to perform or to be the strong one, the perfect parent, or the funny friend, and so that's our way of coping. So we hide the anxiety and the depression and the trauma, and we avoid the stigma. So let's talk a moment about the powerful connection between anxiety and masking. So anxiety often fuels the need to wear masks because it makes us hyper aware of how others might judge us. When we're anxious, our brain goes into sort of a social threat mode. And so we might start scanning for signs of people that are upset with us, disapproving, or who might reject us. And to avoid that rejection or conflict, we might act differently than how we actually feel. So we may hide our emotions, our opinions, or our quirks. And so essentially just putting on a mask. So, for example, someone with social anxiety might laugh along with jokes that they actually don't find funny, or they might act cheerful when they're actually deeply worried inside about something. This can be even more intense for neurodivergent individuals. Many autistic or ADHD people will mask their traits, like stimming. Stimming are repetitive behaviors or repetitive things that a person will do as a way to try to calm themselves or to self-soothe. And so sometimes that might be rocking, tapping, humming to themselves, saying words over and over again, that sort of thing. Or they might do fidgeting, avoiding eye contact, and they do this because they're anxious about being seen as weird or misunderstood. The exhausting part is that masking driven by anxiety often becomes automatic. So people don't even realize that they're doing it because it has just become a survival habit. It's something they've been doing all their life that just has become a habit. It's just almost automatic. Unfortunately, though, it can make anxiety worse over time because the person is constantly fearing being found out if their mask slips. So anxiety doesn't just cause masking, it actually keeps people stuck behind the mask and afraid to show who they really are. So kind of behind the mask and how that relates to mental health and our identity. Many wear masks because of the stigma, as I've mentioned, especially around the mental health. People will hide their mental health struggles, and over time, the mask self can actually start to feel more real than the authentic self. So that kind of leads to identity confusion. So the person will kind of lose sight of who they truly are. And so I'll often get individuals like this in therapy who they're literally asking me or asking, for help of, I don't know who I am or who I want to be. My parents want me to be this one way. My teachers are telling me to be this other way. My friends want me to be this other way. And I don't know which of the three, if one or all of them are actually who I want to be. And so it's a long process to help this person kind of sort that out and unmask and figure out the answer to that question. But as I've mentioned, when you hide your parts of yourself for too long, it can feel like you've lost touch with who you really are. And then that leads to more significant problems. So when the mask slips, here's some of the hidden costs of that. While the mask is going to help us fit in, wearing it is going to drain us. And they call this mask fatigue. But people will often feel exhausted. They're monitoring how they talk, act, react, and it takes a tremendous amount of mental energy to do this. Mask fatigue is a kind of emotional burnout where the person simply is just too tired to even keep pretending. They will feel disconnected from the real self. It creates a disconnection, and it makes it hard for the person to actually form genuine relationships. We start to believe that the mask is who we really are. The relationships suffer because we can't let the people truly see us. And then when we hide significant parts of ourselves, it can create this deep sense of loneliness. Even though we're in a relationship, we still feel lonely. You might feel like nobody really knows you. People who mask report high levels of stress, anxiety, depression. It's linked to poor mental health outcomes across many studies. Neurodivergent individuals, as I've mentioned, are one of the very high-risk populations that this is happening to. And it can lead to suicidal ideation and actually even poor physical health, because chronic stress is linked to things like headaches, muscle tension, digestive issues, and sleep problems. Oops. Sorry, I don't know why that did that double there. One thing I kind of wanted to pause on is something called imposter syndrome. So you may be familiar with imposter syndrome, but when there's masking, imposter syndrome can grow, and it's because we believe that we're living a lie. So imposter syndrome is the feeling that you're a fraud, even when you're very skilled or qualified or competent. You might worry that people will find out that you're not as good as they think you are. You might discount your successes as just luck or timing or a mistake. So, for example, you might win an award at work and think they only picked me because no one else wanted it. Or you might feel that you don't belong in school or your career, even though you've worked hard to be there. So people experience imposter syndrome. They often keep putting on masks. They're trying to appear confident and perfect to avoid being exposed, because again, they believe or they feel like, I'm not supposed to be here. I don't fit here. And what if they find out? And then, I'm not actually who everybody thinks I am. And so there's just this great deal of anxiety associated with it. It's very common among high achievers, women, people of color, and neurodivergent individuals who are all feeling very different from those around them. So we've talked a lot about the masks that we wear and why, and so I want to take a moment to talk about, what it looks like to start actually taking the mask off. So first, I want to be clear, I'm not suggesting that we all go out and start taking all of our masks off and spilling all of our deeper secrets to strangers. Taking off masks is a gradual process, and figuring out which masks are ones that maybe don't need to be there or that are causing disruption or destruction to one's life. It takes a lot of work to figure out what those are. But it starts with self-reflection. So asking yourself, whose script am I following? Are these expectations coming from me, or are they coming from other people, society, my parents, old beliefs, religious beliefs or expectations? Sometimes our masks, come from messages that we picked up as kids, like don't cry or always be strong, keep the peace. And so we carry those into adulthood without questioning them. And it requires some self-reflection then on, what are those things or those voices that you're hearing in your head? Where are they coming from? And are they actually the truth? So next is practicing small truths. You don't have to reveal everything all at once. You can try just sharing one honest feeling in a safe space. So for example, instead of saying I'm fine when you're feeling overwhelmed, you could try just being honest with that other person and just say, I've been having a really tough week. Or instead of laughing off a hurtful comment that a friend or coworker makes, you could say, that actually hurts my feelings. That's easier said than done. Again, that's going to take some work to be able to get to this point, to be able to do this. But it is something that can be done. But these small truths will help us reconnect with who we really are, and it'll help others know the real us. Boundaries are another important piece. So taking off the masks often means saying no when we need to. Saying no to going over to somebody's house for dinner or to hosting a dinner. Saying no to babysitting somebody's kids, or saying no to picking up the extra shift at work. It's hard for people pleasers because for them, it's kind of crucial they see it as crucial for their authenticity. But boundaries are going to protect our time and our energy and our mental health. It's going to allow us to show up as our true selves instead of performing for others. Seeking support is key. None of this has to be done alone. Therapy can help us understand why we wear certain masks and how to safely take them off. Trusted friends and peer groups, especially people who have faced similar struggles, can also make the journey feel less scary. And it's okay if it feels messy or awkward at first. You can think of it like a rehearsal. We try, we learn, we adjust. Authenticity is just a practice. It's not a performance. And here's something important to remember. Taking off your mask doesn't mean you'll never wear one again. Sometimes we still need masks for safety or privacy. The goal is to choose when we wear a mask rather than feeling forced to wear it all the time. And so something just to kind of think about after today, is what is one small truth that you could share this week with someone, even if it's just with yourself. So if you're feeling, tired this week or lonely or overwhelmed, overcommitted, perhaps instead of saying I'm fine or I don't want to talk about it, or I'm going to be okay, you can let somebody, a trusted person, caregiver, a loved one, know what is actually happening, and to then tell them that you're tired or that you're feeling lonely and be more specific. So just a spotlight moment on the power of authenticity. Brene Brown, you may be familiar with her, but she's a very well-known writer, motivational speaker. She wrote Atlas of the Heart, where she really gets into all the different human emotions and defining what those actually mean. But she says that authenticity is the daily practice of letting go of who we think we're supposed to be and embracing who we actually are. So living authentically will bring us better mental health, deeper connections, more joy and creativity, finding purpose and meaning, and feeling fulfilled and feeling more at peace. And these are things that a therapist can help you do. I've helped my clients do, where we kind of figure out, what does being authentic actually look like for that person? What are the things about their mental illness or their personality that are just part of who they are? They aren't things that we actually need to fix or change or necessarily even treat. We just need to acknowledge that they're there and just allow them to be there. And then work on building up that confidence to let those parts of yourself actually be seen. So kind of some a final thought to yourself is, if you could take off just one mask right now, what would it be? It's not an easy question. It's not one you can probably answer quickly or in the moment, but think about if there's one that you've been wearing, maybe one that you keep putting on, or that you're finding you just can't seem to take off. What would it be like for you if you did take it off? And what would be the things that would help support you in doing that, whether that's going to therapy, sometimes taking medication, if there's a mood disorder or an anxiety disorder that needs to be treated. Sometimes we do need to use medication to help open up that door for someone so that they can take the mask off and actually start to examine themselves, look back on their past and their life, and start to work on their identity and figuring out who they are and who they want to be. Okay. And that is the end of what I have. And so I'll open it up for if there's any questions. And this. Okay. I think I have it back to where it's just my face. Okay, good. All right. So any questions or anything, you can drop them in the chat while I'm here, or you can ask them out loud.
I have a question. So when you were talking about all of the different type of masks,
Mhm.
well, first of all, was thinking about myself.
Mhm.
Okay. And then I was thinking about all of our beautiful young kids that just went to camp. And I was thinking about all of the masks that maybe I witnessed and I didn't understand what they were, but a couple stand out to me. So, as somebody who is a priest in the diocese and recognizes some of these masks, um, what do you have? What is the how do we go about engaging in conversations that might help individuals, not like saying, "Oh, I see you're wearing an overachieving mask," but
Mhm.
but helping individuals kind of unmask a little bit. Do you have any techniques or any conversation starters, or just as I just think of our young people who might not be able to vocalize the help that they need?
Yeah, that's a really good question. And something that I find if you're working with young people that you can do is, first of all, starting by pointing out what you see, like and positive things, like as strengths, because again, some parts of these masks are actually a strength. So someone who maybe you see as overachieving, overcommitting, you could just say, well, you're really organized. I noticed you're really good at organizing, or you're really good at keeping track of these things, and you really seem to enjoy a lot of things. And then you can ask them something in a way of just being curious. And I'll even use the word curious a lot with kids and teens, but I'll say, I'm curious, you know, what is that like for you to do so many sports? Like, what has that been like for you? Is that hard? I'm just curious. And that just kind of opens it up for them to just start talking about it. And it's a way to, you're not judging them, you're not indicating that they're doing anything wrong. You're just literally being curious, and you're just inviting them to have a conversation with you about it. I find that to be really effective to get things started. And then, from there, it's just continuing to point out the positive things that they do. And I always tell people, even in some of the most dysfunctional behaviors that I see with people, I can usually find something about it in there that's actually positive. You know, um, somebody who, trying to think if it's someone who's got very rigid, inflexible thinking, and they might have difficulty with transitions, and they might, if it's a really young child, maybe they're throwing tantrums or fits, with transitions. I might say something like, you are really good at doing math, and I can just see that you are really good at focusing and concentrating on math, and I can understand why it would be really hard for you to stop doing something that you're really good at to move on to this other thing. And just get pointed out as that, lead into it with the positive, and then ask that question of like, I'm curious, what's it like for you at home when you have to stop what you're doing, and is there anything that helps make it easier for you, and just ask a lot of like open-ended questions to get them talking about it. Mhm.
So, first of all, as a total aside, it's nice to actually see you. I would literally walk by your new office like the other day. So it was where
Oh, nice.
we looked in, we're like, I wonder who's in there. That's really,
Yep,
it's you.
that's me.
So that's fascinating. At any rate, just realizing that obviously, I mean, we all have masks on, right? And we wear them all the time for various protective reasons and everything else. And you mentioned that masking is not necessarily a bad thing and that it can be healthy. And so my question is, what are some determinations? What are some things we might think of that would sort of help us to make sense of when, like, the difference between healthy masking and when it becomes much more unhealthy? If you could maybe speak a little bit about that and some of the cues to tell the difference.
So, unfortunately, to know when it's, a dysfunctional mask, you start having to look for some of the symptoms of that there's, burnout happening. And it does tend to be that if you start to notice anxiety, depression, like loneliness, isolation, negative self-talk. I see that a lot, like in kids and teens, they might just have negative things to say about themselves. Um, Noticing that there's kind of like a very drastic difference in how they show up, in different settings. Like you might see that they're very calm and confident and, quiet at church, and then they go home and they are like completely, you know, um, out of control, hyperactive, destructive. Like there can be that extreme. Um, so kind of being curious about, I wonder why that is, why it's different in different settings. And usually it's because, well, if you go into church, there's this, and that's not that it's unhealthy in church, right? To be wearing a mask where you're being calm, quiet, cooperative, participating. But then, going home, they take off that mask and now they might be doing destructive things, fighting, hitting physical aggression with siblings or friends. And so you kind of have to look and see, like, is that happening? And it is hard for someone, like, from a community standpoint, like, if you're just seeing them occasionally, like out in the community, it's gonna be really hard for you to notice that, but it's gonna be people that are close to them. Usually it's parents, friends that will pick up on it. But at that point, usually we're thinking about, do they need therapy? Do they need medication? And they're hopefully seeing someone. And that's kind of what we try to teach is that if you're noticing these things where the person is, you know, isolating themselves, having panic attacks, not enjoying life, um, we want to be curious about that and question it and have them maybe go to a safe place or a safe person where they can talk about it. That's where therapy comes in, where it's a neutral person that is trained to be able to pull those things out, examine them, put them in front of that person to look at in a way that's not threatening, or not judgmental. And um, a lot of times just doing that and helping the person become more self-aware that they're masking and that this is happening is like the biggest first step towards helping them unmask. Um, so I hope that answers your question. It was kind of a big answer, but it's really like it's hard without doing the like digging into it.
Yeah, and I don't want to monopolize the time, but maybe a follow-up. I mean, because that was sort of looking, I think, more of an external person. I'm wondering about even like within ourselves, like how as a
Oh,
person we would start going, huh, maybe what I'm doing is not healthy. I'm just curious.
yeah. So usually that's, when the person will start having thoughts, ruminating, kind of feeling like they're disconnected from the things that you're doing. So you might be not present. You might be doing things with your family, but your mind is somewhere else and you're thinking about other things. You might be having burnout. So just, kind of total loss of interest in the things that you once enjoyed, just feeling total, overwhelm, feeling like you're at your capacity. Um, it's it's really hard to give like a blanket picture of what it looks like. Like I said, it's unfortunate that for us, to know if it's happening, we have to really be looking for the negative things that might start happening. But I lost what I was gonna say. But yes, it is hard. Like doing the work yourself, you usually need to have some support or some sort of a structure, to do that reflecting and to start trying to figure out like where these masks are happening and what they are and why. And just overall, just asking yourself, am I at peace? Am I feeling fulfilled? And to what degree? If you're having daily ruminating sessions with yourself about, I just don't feel like I'm on the right path in life, and you're questioning that, then that can be a sign that there might be something happening with maybe not living authentically or masking.
Thank you.
Mm-hmm.
I got a question. Hi. Thanks so much for this. This is some great information. So knowing that we're like church people up in here, I'm sure I would imagine that you come across some spiritual religious trauma in your practice. So do you have any quick tips or, things to keep in mind for us as church people? So I'm just thinking of my own childhood, the stuff I grew up with, much different than the church I'm in now. But how do we not pass some of that trauma on to especially children? Because I'm a mom and do children's ministry stuff at my church.
Mm-hmm. So are you asking, you mentioned like religious trauma?
Yeah. I guess how do we try to, especially bringing up children in church spaces, and with healthy spirituality instead of things that will harm them from their cultural upbringing that's of a religious nature.
The best recommendation I could give is to let our children always know that they have choices, that they have the power to choose, that even though you can say, even though you're going to church, I just want you to know that there may be things that maybe you don't believe or agree with, and that's okay. And I kind of present it as like, it can be exciting because when you become an adult, you can decide what parts of this you want to carry with you and what parts you don't want to. And so just let them know that they have the right to choose, because they do. Yes, we can. Well, I like to say we actually can't force anyone to do something, aside from actually taking their hands and making them do it, and dragging them there. So just really trying to be open and listening to our kids and teens that, if they say, I don't believe in God right now, just again asking, being curious about that. What has changed for you? Is there something tell me more about that? Tell me more about what you're feeling and where that came from, and then just letting them know that you hear them, you see them, that not believing or believing, are choices that they can make, and that you're not going to force them to do one thing or the other. Any other questions?
Yeah, thanks for your answer. That's a beautiful answer. Thank you. And what I'm talking to Stephen about and trying to present children with like, oh, it's okay to feel feelings. Is one of the things I did not learn growing up. So,
Yeah,
it's very
that is
normal.
what I run into a lot. Yeah, where people
Yeah.
like a lot of dysfunction happens and masking happens when we tell our society, and we tell others like, well, just stop crying, don't just buck up, don't feel that way. We try to squash the feelings. And when I have people even come to me like for treatment and therapy, they say a lot of things where they're trying to show that, oh, I've tried to eliminate this already. I've tried to fix it and I just can't seem to. And I usually say, what would it be like if we just had the feeling? Like, let's go ahead and just have it. What does that feel like? And just tell them that it's okay to have all the feelings. It's okay to have different beliefs. And again, just ask questions, be curious about it, let them know they have choices.
I have a question and a comment.
Mhm.
So mine is, since Ivy brought it up with kids and Amy does youth and I've worked with kids, my own kids, is do you have recommended books that are just kind of how to start that conversation or introduce kids to feelings? And like, I think it's an ongoing discussion with adults even as we get into it more. But how do you start that conversation with little ones about, it's okay to feel the feelings? And
Mm.
I think like one of the nice things that like at least the Episcopal faith does is, you're saying like, I'm curious about this. Can you tell me more? And the way that we've done, or at least that we used to do, children's like Sunday school stuff was, well, I wonder, like, I wonder what was going on. So it's kind of similar, but I just didn't know, there doesn't seem to be a good place that I have found yet with
Mhm.
books to kind of help with that topic and that conversation.
Yeah, I mean, I honestly, I don't have any specific book, I've grabbed some here and there over time, like for my own kids, uh, and it's really just kind of looking and seeing. The kids' books tend to be very specific to like one thing, which is good. It might be
Okay.
like a book about anger, and so I would suggest looking for things like that as opposed to like books that have, let's talk about all the feelings. That's okay to do that, but like if you really want to help them, do a little bit more focused stuff. And so I know there are books out there that are specifically about anger or sadness, associated with divorce or um, you know, somebody died, and there's a book about that, like looking for very specific things and then trying to fit it to the child with whatever it is that they need. Because we don't necessarily have to present all of them to them, but
No.
it's gonna be more meaningful to them probably if they can relate to something in their own life.
Do you have any books that you think are helpful for adults, you know, figuring themselves out or wanting to learn more about neurodivergent?
With the neurodivergence, I'm trying to think, I have to grab my books. I have a bunch out in my office, out in my waiting room. Um, there's one like called Navigating Autism. It's by Temple Grandin. That's a really good one. Anything by Russell Barkley, Dr. Russell Barkley, he does stuff with ADHD. He's kind of considered like you know, the world leading expert on ADHD. Um, for adults to like Brene Brown's recent book called Atlas of the Heart is excellent. I mean, it goes through, she has extensively researched every human emotion that we have a word for. We have a word for all these emotions. She in her book defines all of those. And it's just done in such a way that it's like it makes you reflect on every single one of them yourself. So
Okay.
that's a really good book. And really any of her books, because several of hers are about identity, like belonging, feeling like you belong, being authentic. So yeah, anything by Brene Brown, Russell Barkley, Temple Grandin. She's wrote several books.
Okay. Thank you.
Well, I appreciate you guys letting me speak today, and hope everybody learned something that they'll take away. Well, thank you. Take care, everyone.